This video is created by Cervical Cancer Prevention Foundation and it is regarding information about cervical cancer vaccine. Now, cervical cancer vaccines is a vaccine against human papilloma virus or HPV virus. HPV virus is the one which is responsible for most cervical cancers. There are many strains about HPV viruses. The most common or high-risk strains are called as HPV 16 and 18. These are responsible for almost 70% of the cancers. That is to say that not all cancers are caused by 16 and 18. There are more than 20 high-risk strains of HPV virus and many other low-risk types or low-risk strains of HPV virus. Currently, there are two types of vaccines in the market. One is called bivalent, that is, as the name suggests, it is vaccination against two variants, and other one is called quadrivalent, which is a vaccination against four strains. Now, as we have seen, there are many strains of cervical cancer causing HPV virus. Newer vaccines are being developed every time. Hence, currently no vaccine has 100% protection against cervical cancer. So this means that though the vaccine reduces chances of cervical cancer, the screening should be continued as recommended. Now the question is who and when one should take it. In our country, it is recommended that in the age of around 9 years to 14 years, the vaccine is best taken. That is best before the first sexual intercourse. There may be some women who haven't had this vaccine and are in a sexual relation, so they can still take the vaccine and it is still effective to a lesser extent, and they can take it up to the age of 26 years. It is an intramuscular vaccine. Generally, if it is taken below the age of 14 years, two doses are given, first dose and second dose after 6 months. Above the age of 15 years, three doses are recommended. That is, first dose, second dose is after 1 month from the first dose, and third dose is after 6 months. So it is a fairly simple regimen that below the age of 14, two doses are enough, and above the age of 15, three doses are needed. Now there is always question about side effects of these vaccines. So as we know that these vaccines have been used for last 20, 25, 30 years around the world, and millions of girls and women have been vaccinated. There hasn't been no major side effect or long-term side effects are seen by this vaccine. There are some minor side effects which are seen with uh, any vaccine. So similarly, they are seen with cervical cancer vaccine, and these side effects occur in first 2 or 3 days. These are mainly pain at the injection site, maybe little body ache or mild fever, but no major side effects are observed. And these minor side effects can be easily managed by taking simple painkillers or tablets like crocin. So in conclusion, what we can say that all the studies so far around the world has shown this vaccine to be effective. Some studies claim it to be as effective as 70% reduction in chances of cervical cancer. It is best taken at the earlier age, preferably before the first sexual intercourse. There is no booster dose required. So once you take 2 or 3 doses of vaccine, depending on when you start, below the age of 14 or above the age of 14, once you have taken these 2 or 3 doses, you do not need any booster dose. It can be taken even after being sexually active, but the protection is less. So as we have seen that though it reduces the chances of cervical cancer, it does not completely eliminate. So most important thing is not to go in a comfort zone, but screening should continue every 2 years as recommended. I hope this is useful. You can visit for further information to stopcancercervix.com, which is the official website of Cervical Cancer Prevention Foundation. Thank you very much.